this work is an immunological analysis that actually started quite a few years ago when I was working at NIH, where we described this particular phenomenon that CD8 cytotoxic T cells were having distinct and very robust contacts with interactions with B cells in an autologous setting. This is something that was quite unexpected. It was not an antigen presentation, of course. It was not even a class 1 MHC antigen presentation from the B cells to the CTL. But what we described at that time, it was an interaction that was geared towards the help in survival of cytotoxic T lymphocytes. So these lymphocytes were, after the contact with B cells, were benefiting from a set of cytokines, of chemokines that the B cells were releasing, and therefore they were surviving more and recalling other T cells. So we checked and we kind of went deep in this phenomenon with kind of different analysis methods like microarrays, videos, flow cytometry, and we initially described this phenomenon. We didn't know at that time if this was relevant in a clinical setting, but afterwards, after some years, I came back to Italy and I started working with allogenic bone marrow transplant patients, and I wanted to check if this phenomenon was perhaps a sign of the inflammation or a sign of some sort of clinically relevant phenomenon that we could analyze in this patient population. And actually, doing a study, a retrospective study on patients in this center that had GvHD and patients that did not have GvHD after transplant, I found that this phenomenon, this particular phenomenon, that are these couplets, BCD8 couplets in the blood, was distinguishing the graft-versus-host disease mostly of recent onset, within 30 days of onset. So we described, in collaboration with Zoltán Posz in Hungary, that has a nice GvHD mouse model. We described that these couplets of BT cells were also present in this model of GvHD, and we could define in this mouse model that the B cells and the T cell were coming from the donor. So again, it was an autologous phenomenon in the reconstituted blood of these mice. So it was the donor, B cell and T cell from the donor, that were coupling more in GvHD mice, especially in Pyer patches. So the fact also that this, in the first analysis that I performed in these couplets, we described that IP10, MYC, and ITAC were the three most secreted cytokines, the chemokines. These are really signature cytokines for graft-versus-host disease. So encouraged also by that, we wanted to explore more the features of this coupling. So what does this coupling mean in the setting of immune inflammation? So we set up an in vitro assay to study in healthy donors the coupling, enriching for cytotoxic T cells after 2 weeks of expansion of autologous B cells of HLA-A*02:01 healthy subjects with the relevant HLA-A*02:01 peptide. And after these 2 weeks of expansion of CTL, we measure with freshly selected B cells from the same subject. We measure in a co-culture this phenomenon of coupling. So we could understand first. We could first confirm with a nuclear dye that this coupling that we saw at the flow cytometry were real couplets. So formed by 2 cells, CD19 and CD8 positive. Couplets are formed by alpha-beta T cells, and there is also a CD45 array CTL phenotype that we are following, although we can say that CD45 array minus CTLs are participating for the couplets because the B cells, surprisingly, are all CD45 array positive. So since when there is the coupling, we cannot distinguish at the flow cytometry who's coming from whom, because it's a couplet that is measured at the same time. But at least to understand, to confirm, as we were confirming we were observing at the NIH, to confirm that is the coupling is happening through the CD27 and CD70 molecules. With some experiments, we labeled the cells separately before with 2 different dyes, and so we could understand that the CD27 comes mostly from B cells. So it is CD70 positive T cells that engage relationship with CD27 B cells. The couplets are not abolished after a blocking of MHC class 1. Again, we did that, this experiment interfering with the MHC class 1 to make sure that it was not an antigen presentation. And the same we did, we blocked the CD8 on T cells to understand if by blocking CD8 the couplets was not taking place, but again the coupling is taking place. Then we measured by videos in time-lapse videos with a confocal microscope that has a chamber of a culture chamber attached to it. So we could measure and follow B cells selected and stained for CD19 and CTLs selected for CD8 and stained with CD8 with another staining for calcium flux. We could measure the calcium flux spike between the couplets, and we could see that there is actually an activation of both B cells and T cells in 2 different, two separate patterns. So one pattern of activation sees the cells very tightly connecting together, interacting together from 5 minutes to 1 hour, and this spikes a higher flux in the T cells. And the other type of interaction is kind of a sniffing. So it's the cells are not tightly bound together, but they face each other also for a long time, and this interaction is spiking up a minor flux in the T cells. So currently, what we are doing, we are trying to understand if there is a transcriptional change after coupling in the B cells and T cells, if this is reciprocal. So the T cell trigger some transcriptional change in the B cells and reverse, and so what really is the meaning of interaction. After doing that, in healthy subjects, we will go back to the blood of graft-versus-host disease patients to measure if this is actually the same phenomenon, and if in case we can exploit this coupling of cells, of B cells and T cells as a biomarker for GvHD, or if it can enlighten a little more some mechanistic explanation in the GvHD setting.